Good morning and welcome to the 9:30 call. It's good to see folks. Give folks a minute to get in the room. Good morning, Rep Schwartz. It's great to see you.
Hi there, how are you?
Good, thank you. Well, welcome to the 9:30 call. We'll give folks a minute. As we're waiting, it was so great to see folks on the call yesterday with Marty Walls. Thanks so much for sending all the questions ahead of time. We are going to send Marty the full chat. We are going to create the kind of follow-up documents that we talked about kind of compiling all the resources as folks are thinking about their board of directors. And we'll, continue to keep the open invitation for Marty to have her join us here in the 9:30 call. As you can see, I'm back in Boston in our office on Beacon Street. We had an incredible day yesterday, Washington, D.C., starting with the 9:30 call in the stairwell of the Cannon Building. We met with the offices for Congresswoman Ayanna Pressley, with Whip Catherine Clark, with Senator Ed Markey, and then and Senator Elizabeth Warren, with both their offices. And when we were in with Catherine Clark's office, they offered us passes for the House Gallery because the House was in session yesterday. So we got to go to which I have never been. It was pretty incredible to go to the House Gallery. First, as all 435 reps voted whether to move the budget resolution forward. And then we got to see some of the back and forth debate. So it was pretty cool to be there. As folks may have heard, the House voted to kind of this first step in the budget reconciliation, which we know we heard from Danielle Ewan. And so it's the framework of the budget, kind of directing now folks to think about what that budget will look like. They do have a March 14th deadline. And so then during sharing the mic, one of our Wednesday calls, we'll talk more about what we heard from congressional offices. The headline is our congressional offices need the stories of folks that are impacted by what's happening in Washington, D.C., by any of the policy or budget changes. So stay tuned for more information about that. Um, I think, Tom, your question about analysis, I think a lot of our national partners are working on if there was an X% cut to Medicaid, what would that mean for children?
Hmm.
One thing yesterday we did hear during the debate is anytime a kind of a Republican would go up to talk about the merits of the bill, a Democrat would respond with whatever state they were from. If this bill goes through or this proposal, this is how many people would lose Medicaid, or this is how many people are in Medicaid in your state. So I think there's a lot of our allies at the national level and the organizations tracking that. So we are excited to continue our first year meet and greet with legislators with Representative Greg Schwartz. And we also want to thank Charlotte Bruce, who has joined us this morning and will give us an update on the Healthy Child. I'm going to get the name wrong, Charlotte, on tax credits. And Charlotte and her team have done incredible work in Massachusetts. So we're excited to hear the update. So we'll start with you, Representative Schwartz. And this has been a long-standing tradition for Strategies for Children. We did this in person pre-COVID, and then in 2020, after that election, we started doing the meet and greet on the 9:30 call with all the folks who joined us from across the state. So we're happy to have you here. As we said in our kind of outreach, this is a call for the early childhood community across many different spectrums. But our first question for everybody is for you to tell us a little bit about you and why you decided to run for office.
Well, thank you so much. It's so great to be with you guys, and I appreciate the opportunity to introduce myself and at your call. When you say Representative Schwartz, I kind of want to look behind me and say, who are you talking to? So I'm a first year, as you guys all know. It's still sinking in. It's been an amazing experience so far. I'm very much looking forward to being active on a lot of issues that I hope you guys care about. So I'm the successor to Ruth Balzer in the 12th Middlesex. I like to say I'm Ruth 2.0, partly because that makes people, know where I'm coming from, but also we share a lot of similarities. She was a clinician. She was a clinical psychologist before she joined the House many years ago. And she brought that perspective to many issues that were very important to her, and she made a lot of impact as a result. I am also a clinician. I've been a PCP for the last 25 years um, at Mass General first and then Brigham. And I take care of patients 18 years old and up, and take care of all their medical problems when they're mostly as outpatient, but also have taken care of them as inpatients in the hospital once they're admitted, and have worked on doing education of trainees, residents, and medical students. Um, so the question, of course, is how did I get to this? Why, especially my background. Um, so growing up, my mother actually was diagnosed with early Parkinson's disease when I was in elementary school. So I saw up close kind of how the healthcare system interacted with families and patients who were dealing with chronic medical problems, significant medical problems, both well and sometimes not so well. And I think that that instilled in both me and my brother a strong desire to be direct service folks. We both went into medicine, but for me, it also the challenges that we experienced and she experienced gave me a strong desire to also affect the environment and the structure that affected the care that she was getting and other folks were getting. So throughout my training, throughout my education, I kind of did this dual track where I pursued both the medicine, but also political and policy opportunities. I went to Washington after I graduated and worked for an advocacy group that was involved with tobacco control, but then I joined a congressman's office and worked as a legislative assistant for a year and a half. Then when I went off to medical school, I had an opportunity to do law school along with it, and I did because I wanted to have that policy background. Um, in medical training, when I came up here for my residency, I did a stint at the Attorney General's office. And then as I became, practicing physician at the Mass General in Brigham, I was involved with some policy issues and then got involved with local politics at the city council level. And so this is kind of a very kind of natural extension of that. And to be honest, much more at the state level than at the city level, I think that there's an opportunity for someone with my background, with my experience dealing with patients and all that they deal with on a day-to-day basis to bring that perspective to the discussions around not just medical and health policy, but also around mental health, substance abuse, so many other aspects of the policies that we work on are affected by health and affect health. So environment, workforce policies, so many other things. So I'm really excited to bring this perspective to the legislative process. Already, I've been very encouraged by the reception that my colleagues have given me. I'm looking forward to, just like you were saying, Amy, to bring those personal stories, those anecdotes from individual care relationships that I've had over the years, as well as hopefully ongoing, since I'll keep a little foot in the medical field, and be able to bring that to the debate and try to humanize it and make it more impactful. So I'm very interested in working with you guys on childhood issues.
Okay, in the chat. So as folks continue on the call, please show some appreciation in the chat. And Harold just wants to confirm, did I hear that right? You are a doctor and a lawyer.
I am yes. As I mentioned, I did the law school, so yeah, I passed the bar. So yeah, so I am a lawyer. I've never practiced in, well, I did some work during law school in some, legal clinics. So I worked with patients, I'm sorry, clients who were facing evictions. I did some landlord-tenant stuff, and also folks that were dealing with Social Security, disability insurance denials. But primarily, my actual direct service has been, medical.
And we know we have some constituents on the call this morning, so that's been also such a benefit of having folks join the call, because there usually is always a constituent on the call. We heard from your colleagues, Rep. Badger and Rep. Sylvia, and they're going to help us get other folks to join the 9:30 call. So we hope you'll join us in that kind of
Course.
recruitment. It's just an incredible way. This community has been incredible. We started it 5 years ago. The week of in March 13th when COVID started. We're
I remember it
celebrating our
well.
5th year anniversary. We've been doing it first 5 days a week, now 4 days a week. And as you can see, we had 72 people join us this morning. Um,
Great.
as we kind of we will, and we're so grateful that you could join us and for all that you are going to do. We always want to say we want to be a resource to you. We have experts on this call, and kind of all things early childhood and young children families. Anything surprise you in your first couple of weeks on the job here?
Surprise. Well, I think that it's not, maybe surprise is too strong a word, but a strong um, kind of newfound appreciation for the three-dimensional chess that legislating really involves. And what I mean by that is, obviously you run, you know about the constituent service, you know about dealing with your constituency and trying to represent them. At the same time, there are all the advocacy groups and obviously very issue oriented. Also something you encounter while you're running, but also, you especially encounter during this time around individual bills and legislative priorities. And then the internal politics and strategizing on how to be effective. And it's really multiple constituents, multiple audiences, multiple levels that you have to kind of consider while you're trying to move forward with the important work that you want to get done. So it's a kind of a strong appreciation for that, all those three different elements and how to make them all work in line for your goals. So that's been my biggest takeaway for the first month and a half.
That is so helpful. And I think we talk about that all the time about how, as an elected, you have to be kind of an expert. You have to know a lot about a little about a lot of things and rely on the expertise that kind of that we can bring to that. And I think we've seen such an incredible progression of people becoming more comfortable as the role of advocates and connecting with legislators. So we also we do the first timers at the public policy forum we just came from in DC. And over half the 400 people that were in DC were first timers. And we say no one hit wonders. And so we want to make sure that we are not one hit wonders with you, that we continue to build this relationship with you and just would offer us as a resource. Early education and childcare policy can be confusing and complex. So we're happy to help you kind of think through that and how we can be in supportive of you in your new role.
Thank you. And I would just add that, I've been on the advocacy side with some
Right.
of the issues. I did not just when I was in DC, but here in Massachusetts as a physician, worked with Mass Medical Society and American College for Physicians. And I'm very much aware of when you're approaching the
Right.
legislator, like all the issues that you're trying to figure out and how to prioritize. So I try to be mindful of that when I'm meeting with people and try to put them at ease and also understand like where they're coming from. So I hope that you'll find me to be an open and accessible ear on these issues.
Thank you so much. So continue to show the appreciation in the chat. We'll send you the chat so you can get connected. And now, Charlotte Bruce, we would love to hear an update from you.
Thank you, Amy, and great to meet you, Rep. Schwartz. My name is Charlotte Bruce. I'm the Director of Policy with Children's HealthWatch at Boston Medical Center. So also approaching policy very much with that clinical perspective. And I have a PowerPoint I'm going to pull up, but I'm here today to talk to you about two things. One, Children's Health Watch and Boston Medical Center, we lead a tax credit coalition to expand the state earned income tax credit and child and family tax credit, really as a way to get money back into families' pockets. And so the first part of what I'm going to talk to you about is that right now is tax season, and there's an opportunity for families and folks in our community and ourselves to claim some really important and some really big new tax credits. And then the second part, I'm going to very briefly, because I know time is limited, just explains our legislative campaign this session. So one moment while I pull this up.
And Charlotte, we're glad this timeliness works for the tax piece, but we're happy to have you come back to talk about the campaign.
Oh, fantastic. Yeah, I will focus on that. Let me just make sure. Okay. Slides looking good?
It looks
Okay,
great.
great. So as I said, there are new and expanded tax credits available this tax season that families can claim. And what we're doing with this outreach campaign, and the goal of really tax outreach in general, is to increase access to cash for people who don't typically file taxes. So when we're doing these presentations and focusing our outreach efforts, we're really focusing on families who don't necessarily or haven't necessarily earned enough income to be obligated to file taxes, but they still could be eligible for thousands of dollars in tax credits, but missing out on it if they don't file a tax return. So we really want to raise awareness among particularly that population, which we often call non-filers. So what could families in Massachusetts get this year? So this is all on a website that I'm just previewing some pieces of called findyourfunds.org. But there are a number of tax credits for folks who don't have any income in 2024, or if they just had very little income. So again, these are all credits for folks who could fall below that tax filing threshold. The biggest one that I'd like to focus on is the child and family tax credit, because that's a universal credit. You don't need any income. There's none income cap, so you're not facing a cliff, and that's just a flat $440 for eligible dependents. So that includes kids under 13, as well as some other dependents and older folks in your household. You also don't need to have a social security number to claim that credit, nor does your child. So if you have an individual taxpayer ID number, or if your child has that number, or you can sort of go through a process to request one from the state. But essentially this credit is unique because it's immigrant eligible, whereas a lot of the other ones at the state and federal level, unfortunately, aren't. And then if you do have some earned income, you could also qualify for the federal child tax credit and both the state and federal earned income tax credit, which are pretty significant amounts, as you can see there. In addition to those, you are also able to get credits from past years that you didn't claim. So this year is the last time that you can claim credits from COVID. So whether that's the COVID stimulus check or the COVID child tax credit, you are able to get that this year. Again, last year you can do that, as well as if you missed this new child and family tax credit, which has only been in place at the state level the past couple of years, you can file for prior years and get that too. So again, the child family tax credit is really what we're focusing on, $440 for each child under 13, universal, and ITIN eligible, which I had explained before. One other thing that I'll note is that that tax benefits, this cash that families are getting, it doesn't impact eligibility for other benefits. So because it's through the tax system, it wouldn't impact their eligibility for childcare or Medicaid or SNAP or any other benefits. So just to go through some quick examples, just to really demonstrate how much families could be eligible. So this is a single parent with 2 young kids who made $8,000 last year, and this would put them below the tax filing threshold, so they wouldn't need to file a state or federal tax return. But if they do, they could be eligible for over $9,000 in credits between these 4. So again, just really underscoring how important it is that folks, even if they don't have that tax filing obligation, are aware that they could have money available to them. And the second one, this is specifically looking at a mixed status family household, so ones that have a social security number, as well as parents who have that individual tax ID, so immigrant parents. This slide shows that, like I mentioned before, unfortunately, they're ineligible for some credits, which is part of our legislative campaign working to change that. But there is still money available for them, and if they file taxes, they could get it. And so I think also really underscoring that it's safe to file taxes with that individual tax ID number, and so families should feel comfortable doing that. And then again, does not count for most benefits. So spreading the word. So this is where I would love help from folks on this call. So we have this website called findyourfunds.org that was stood up during the pandemic, really around those COVID stimulus checks, child tax credit, pandemic EBT, other programs, to make sure families were aware of it. And these are some of our partners who work on it with us. And the key messages that we're really trying to push out is that families can get thousands of dollars in state and federal tax credits, even if they didn't have earned income in 2024. The second piece is that on this website, we have a ton of free resources for families to be able to file their taxes, whether it's in person, online with chat support, on their own, in different languages, that there's a lot available, because we don't want people to file for their tax return and then end up getting a chunk of that taken back by some of those paid preparers out there. And then the second piece is also, again, this is the last year to claim those COVID checks, which are pretty significant. These are some of the, it's just a screenshot of the Find Your Funds page. So again, there's a a few different options if depending what your needs are, what's best. The IRS also has this new resource this year called Direct File, which is a very simple, free online tool with support on chat and on the phone. So what we have for you all is we have a couple of outreach materials. On the left is a flyer that has a QR code to the website. Again, very focused on the child and family tax credit since that's the most universal and applicable across communities in Massachusetts. And we have this available in 11 different languages. So you can send it out either electronically or you can print and have flyers that way, but in different languages. And then we also have a social media toolkit. So if you're able to uplift that. Some other outreach opportunities, we have some sample messaging if you want to just put like a short blurb in a community or staff newsletter, put anything on your website, guest presentations like this. I've been very lucky to be able to present at different coalitions about the tax credits. And then we've also had some really great partnerships with state agencies. So DTA, for example, did a text messaging campaign where they were able to contact SNAP recipients, and then folks from DPH and EEC have also been incredibly helpful in getting the word out to families. This is a very sad looking Instagram page because we just started it, but we do have an Instagram page for Find Your Funds that's just going to be purely on the tax credit resources. So I'll stop there so we have some time for any questions that come up.
So one of the questions was about your slides, and we'll add them to the follow-up folder. So we always add, and yeah, there's a link to the whole folder, and then there's a folder called slides. So we'll add that. I added the link to find the funds in the chat. Are there any other questions from folks, either in the chat or you can come live?
Charlotte?
Yes.
Can I ask, just are you encountering any hesitation on the part of folks to access these in the current environment, as far as fears, especially if the people are immigrants, on kind of engaging with the state or federal folks?
Yes, we definitely have particular specifically in the immigrant community. I think we're seeing that across many programs, just like a huge increase in chilling effect. So for programs that families are eligible for, and just being worried about filing. And then there's been a lot of things in the news about, like Elon Musk getting like the treasurer taxpayer information. So I think that's been contributing to the fear. So we've been working with community partners like La Collaborativa, like Mira, and others who are really connected to those communities to try to get the word out that it's safe to file, particularly or specifically if you have that ITIN.
Right.
Appreciate the question.
And then appreciation in chat for the diversity of outreach materials in so many different languages, and love the blurb for the website. We can add it to our newsletter as well.
Fantastic. Yes, I will send all this information to Amy. And then if you go to that website and there's a tab on outreach, and that's where you'll find all the flyers.
Great. So do you want to tell us about in the last 3 minutes about the campaign?
Yeah, I will. I'm glad I flew through that so quickly. So we probably don't have time to share.
Of the 9:30 call, Charlotte. You did it, ma'am.
I can talk fast. I'll include these in the slide deck that I share around too. I don't want to waste time pulling that back up, but yes, we have refiled bills with Senator Eldridge, Senator DiDomenico, Rep Decker, and Rep Vargas to further improve the state earned income tax credit and child and family tax credit. So specifically, that would be extending the EITC to immigrant households, as well as extending generosity of the credit. So making the credit bigger, making the child and family tax credit bigger, and also inclusive of kids over the age of 13. Those are some of our biggest priorities. We're called the Healthy Families Tax Credits Coalition. So again, I'll include this information, but any support with like we're doing a co-sponsorship drive right now for those bills, as well as focusing on some specific budget asks, which our budget ask is specifically this year for the extending the EITC to immigrant families, and then also level funding VITA, which is volunteer income tax assistance. So ensuring that we can offer these sorts of outreach material or outreach programs where families can go in person to get free tax prep and support because it's often a really scary process and you don't know how to do it or what to take in. And so we want to make sure that there's continued state funding for that. And we're actually having a briefing at the State House on March 11th. So I can send around some information on that too. Would love to have you there, Rep. Schwartz, and everybody else on the call. Would love to see folks at the State House.
Absolutely. Please include me.
I love this easy access there, Charlotte, to have the rep with us this morning.
I
And
know,
so
great timing.
I just put we've been really grateful for the work of the Healthy Families Tax Coalition. I think is part of the early childhood agenda. It was been so great to kind of strengthen our partnership, Charlotte. Can you talk a little bit about what's your best advice for folks who have direct connection with families? How do they help spread this word about kind of what's available and where they should go for support?
Yeah, I think the like flyers, the social media, the just like really underscoring there's free cash available for you and you can get it by just filing this tax return. And I think something I've found impactful is to share some of those examples of the amount of money it is. Because I think
Mhm.
a lot of times with a lot of programs, there's so many hoops to jump through. People don't want to, I mean, you see this with like SNAP benefits, for example, or like
Right,
people jumping through all these hoops to get a small amount, but if they know they can get hundreds, thousands of dollars, I think it makes it a lot more worth it. And then also that piece around this is just money that's not going to impact eligibility for anything. It's just
right.
money back into your pocket that you are owed um, from the government.
So helpful. So as you continue, when there's a hearing on the bills and kind of when you need support, please come back to the 9:30 call. We're so grateful for our partnership and just to have your expertise and the expertise of the coalition to help connect it to the people who are doing the work. Um, so please also add some appreciation for Charlotte and the work in the chat we've seen. And just a quick reminder, we will be live for the 5th anniversary of the 9:30 call. We will be on Zoom as well. But we're going to have a live kind of broadcast from Worcester. We're confirming the location, and we know that we've already heard from Somerville about hosting a watch party. So we'll have more about that about the 9:30 call. But thanks both to the rep and to Charlotte for joining today. And we will see tomorrow. We're going to have a panel facilitated by Hung Wu, who is one of our Advocacy Network alumni. Of the parent perspective in the city of Boston and how they're working together to kind of make sure the parents are part of the practice of policy. All right, we'll see everyone tomorrow morning. Thank you so much for joining us and have a great day.
Thank you.
Thank you, Charlotte.